I would like to present this clinical case as an example of using round tripping in order to achieve successful tooth rotation by a significantly large degree. We currently observe evident crowding in the upper arch. It is more convenient to view this in the right-hand window on the 3D model. We can see significant rotations of the upper and lower central incisors, especially here, as well as a space deficiency. Therefore, we will follow my standard treatment protocol, which begins with arch expansion and the use of round tripping. This means we tip the posterior teeth buccally and the incisors labially, while at the same time rotating them in a controlled way. And it should also be explained why we cannot work only with the teeth from canine to canine, since such a limited approach would not provide good results. Because when we engage the entire surface of the aligner, when we expand the entire geometry of the tray, the effect on the anterior segment is much greater than if we were working on a single tooth. In other words, the tray expands evenly across the entire surface and better pushes the front teeth in the vestibular direction. Let's look at the animation. We move the teeth into this position, placing incisors and canines with small gaps. At the first layer, we place negative attachments to help with the rotation of these teeth. Then we perform retraction and complete the rotation by moving the negative attachments to the vestibular surface of the teeth. This is our final result with a slight overcorrection. The upper right central incisor was initially more palatal compared to the left one, so we need to position it the other way around, slightly more labially. We apply the same logic to all the other teeth as well. Now let's look at the lower jaw. Here it is the same approach. We perform round tripping, expand the molars and premolars, and incline the anterior teeth labially. Once we reach a certain point, we usually evaluate the bone. The main priority is to avoid fenestrations and dehiscences. When we see that the bone becomes a limiting factor, we reverse the movement and move the teeth into their final position. What is important in this case is that we leave almost the entire amount of interproximal reduction for the final stage, when the teeth are already relatively well aligned, and it is not difficult for us to perform the interproximal reduction with a file. If we perform it at the initial stage, there is a risk of doing it incorrectly at the wrong angle and damaging the tooth anatomy. That is why we plan the setup so that the main volume of interproximal reduction is carried out in the final steps. Now, let's see how it looks in real life. We begin with aligner wear, the teeth move labially, and the round tripping process goes successfully. Gaps between the teeth are opening. I have a shot at the final stage. We still need to slightly upright the lateral incisor in the lower jaw, but the overall final result is already visible. The incisors aligned without any refinements or extra aligners. This was achieved thanks to well-planned round tripping. The same applies to the upper jaw. We see that the teeth were initially rotated in this way, and here's the final result we achieved after the orthodontic treatment, and here's the frontal view. Let's compare it. We can see that the molars have gained a greater buccal inclination. The smile looks more aesthetic, and with a bit of enamel edge contouring, the result would be even better and more harmonious. So, what conclusions can we draw from this case? Do not be afraid of round tripping. I strongly recommend practicing it, but always pay attention to the bone. If the teeth move beyond the cortical plate, you must proceed with caution. It is important to note that brackets, except for lingual ones, always work through round tripping. When we place a flexible arch wire, the teeth are inclined toward protrusion. Therefore, we act in a similar way with aligners. But since we control the position of each tooth individually, our treatment progresses faster. In this case, we needed 22 pairs of aligners to complete the treatment. As the case was relatively simple, we instructed the patient to change the aligner every 7 days. By the way, you can order a virtual plan from me. We can make a virtual setup for you, send STL files for printing so that you could print aligners in your lab. Also, if you make setups by yourself, you might find it interesting to use my service for storing virtual treatment plans. You can upload your clinical cases to our service, which is called viewer.dental viewer as done here, and then adjust the visual display of the models. You can add your logo, your background, adjust transparency, adjust glossiness, and matte finish of the models. You can customize colors, icons, logos, and domain name. and make it so that the viewer's design matches your business's brand style. Thank you for watching.